So welcome again to part 2 of the first session on social determinants of health. So in the first session, we actually reviewed what were the drivers of population health. In this part 2, we're going to talk about, do population distributions in all countries follow this pattern? And to recapitulate, so we ended the last session with this idea that the population carries a collective responsibility for its own health and well-being. And the second part is that distributions of health-related characteristics move up and down as a whole, that the mean drives the tail. So one of the things that people have really questioned is this true? Is this true now? Is it true in all countries? Is it true over all times? One of the things that we suspect is that Jeffrey Rose wrote this actually at the very tail end of his career, dying shortly after he finished these works, and didn't have a lot of time to actually think about what it meant to think about the distributions of population health, and actually whether they would always look like these normal curves, and always our situation was to move the entire curve to the left, to a lower risk category, that there might be other kinds of situations. So here are two very, very simple cases. If we think about time 1 in blue and time 2, I think the way Jeffrey Rose thought about this is that everyone changes at the same time, that the curves look exactly the same, and that our options are that we try to move the entire population to a lower risk category. And that's what's represented here. That's hypothetically an interesting idea. In his examples, things certainly looked like that for the kinds of things that he was looking at the time he was looking in the countries that he was looking at. But certainly there are some other possibilities. So here's another possibility. People change differently. That time 1 looks like this very tightly normal curve, but actually over time, some people change a lot and some people change not at all. That's entirely plausible and one of the possibilities. So again, as we think about social determinants, we want to think about patterns of population distributions and what they might look like. So I'll give you an example that has to do with obesity. So if we look at this and think about this pattern in terms of economic inequalities, we might think, well, in time 1 in the United States, for instance, this was the distribution of income. By 20 or 30 years later, there are a lot of people who've gotten very, very wealthy. So the curve has moved a lot out to one direction. But actually, the number of people who've stayed poor has not changed at all. So this creates growing inequality, right? So we might think of the second curve at time 2 as an instance of growing inequality. And this is something that Rose never actually articulated. It's the work for us to be doing now. So if we think people change differently, how might we test that? How would we know whether that's happening or not? So I'm going to give you one example that illustrates actually this phenomenon. So here we think of the ways in which people might change in terms of BMI. So the black dotted line represents time 1. Everybody has the same association with BMI. The distribution stays exactly the same. According to Rose's paradigm, he has the red line, which is that there's a uniform change. That is, over time, everybody increases their body mass. Everybody has gained weight at the same time. Whether you were really underweight or really overweight, you changed at the same rate. But there's lots of ways in which we might think that's not actually what happened, nor is it really optimal. So we think, for instance, if we look at the green line, there's this asymmetrical change where some large number of people actually haven't changed at all. At the bottom of the body mass index, people track along that black line and have not changed at all. But people at the high end of the body mass index have changed a lot. So their curve actually goes up. So that's another pattern. And we might think ideally what we'd like is that for people who are really in certain countries malnourished, that ideal change might be for people to gain a lot of weight who were really underweight. And for people who are overweight, you actually want them to lose weight. So ideal change might not follow this pattern at all. So once we start to think about this, we come up with a lot of possibilities. And I think one of the challenges for you all over time is to think about what happens in your country and how can we characterize these kinds of changes and what's driving these changes. So I want to show one slide of data in Bangladesh. This is a study that's done by Dr. Razak, Corsi, and Subramanian. It was just actually published in PLOS Medicine, and it looks at change in body mass index for women. And actually, they looked at these studies, they looked at these relationships in 37 countries that were low and middle income countries, largely from the demographic health surveys. And actually, what they found was what they suspected, but was never confirmed by Rose, which is that people change differently. So if we look at the top slide, that is the very upper curve, we see the distribution of body mass in an earlier period in 1996. And then we see what happens a few years later. So the second one below it is actually 1999. And what we see is that exactly the same number of people have stayed underweight. So malnourishment is still a very important problem. But when we look at the tail of overweight, actually that's increased. So people change differently. And if we look at 2004, you see that exact pattern even more exaggerated. Again, the number of people who are in the low malnourished category has stayed the same. So undernourishment, low body mass index, remains a very, very important problem in Bangladesh. At the same time that increasing obesity becomes a problem. And then when you look in 2007, you see it grow even more. So over these years, between 1996 and 2007, the number of people in the lowest range for body mass has stayed exactly the same, hasn't improved at all. So if we think malnourishment is still a problem in Bangladesh, it is. It has remained a really important problem. And at the same time, the number of people who are now obese in the overweight category has also surged. So what's happened, and this has happened in many, many low and middle income countries, is that both things have happened simultaneously. It is not like Rose described where the curves just shifted, but in fact, the curves look really different. The distribution, if you look at the mountain in the first time, kind of looks like a volcano by the end. You see this flattening distribution, where the mean has not changed that much, but the tails remain really important for us to consider. And this is something that's been completely neglected. So if you were to say, focus only on obesity or overweight in Bangladesh, you would say, oh my goodness, this is a growing problem in Bangladesh. But you would have ignored the consistency of the problem related to being low body mass index. So these both things become a problem now at a population level, something that we have really not understood until recently. And here again, on the other side, you see these curves which show the distribution by time and the percentiles. So what you see is that for people in the bottom of the BMI index, nothing has changed over time. There's still many, many people in that category. But you see, by looking at the black to blue to green to red lines, that the incidence or the prevalence of high body mass index has increased enormously. So this poses, I think, for developing countries a completely different set of problems. Like, it means that we have to attend to both of these things at the same time. And we have to use very different tools to be able to look at them. So at the conclusion of this article, Dr. Razak concludes that populations gain weight unequally, and that there's a widening inequality in how weight gain is distributed. So So the 95th percentile of the BMI is increasing 2.5 times the rate of the 5th percentile. And the middle of the BMI distribution, which is actually the healthiest distribution, is actually getting smaller. So that means that it's particularly important for us to think about this relevance given the possible J-shaped relationship between BMI and mortality, which is that both ends are risky. It's only the middle that actually is the not risky part. And finally, they conclude, I think in a very, very important lesson for all of us, that a single measure does not represent population change. Change in average BMI is not equal the same degree of change at both ends of the BMI distribution. And therefore, a single parameter in isolation is often misleading, or may often be misleading. And a more accurate analysis of how populations change requires information about both the center and its extremes. So in contrast to Rose, who said the means drive the tail, in fact, the data for low and middle income countries and change currently is quite different. It suggests that the mean actually is not changing much, but the tails have changed enormously. So Rose's theories were the beginning of understanding determinants of population health, but not the end.